Hi, good after, still morning.
It's
Do it all
still
the time.
morning.
Still morning. So, Dr. Brian Amison,
Dr. Richard Huetter.
and welcome to Tuesday Tooth Talk. Again, I can't believe it's been a couple weeks
It's been
now.
2 weeks already. Yeah, it seems like it's been busy, it has been busy. It's been really busy
Oh.
around here now that we've gotten back pretty much into full gear. The remodeling is done. Hardly anything left to do. Even little touch up. So we're really rolling now. We're getting a groove, learning what room numbers are what when it comes to the new rooms, because we have additional rooms more than we had before. So we have 10 instead of 6 or whatever we had before. So it's a new configuration, and we're still learning that configuration, but we're getting more familiar with it. So yes,
Right.
It's been a busy couple of weeks.
But yeah, so trying to figure out what topic to talk about today, and
A different topic, and a topic that I just heard about.
Mhm.
So you brought it up, and I haven't done enough research on this.
Oh, okay. Well, it's.
But I
I'm sure
couldn't help it. I put it on Facebook that we're doing this. Get the lead out. I couldn't help it. You can look at that in so
good
many
one.
ways. Get the lead out, meaning
Oh.
hurry up. That's like the old way. Get the lead out. Led Zeppelin. That's what everyone says. When get the lead out, you're putting Led Zeppelin on the radio, or whatever
or
medium you're using.
or lead. Remember lead gas?
Lead in the gas. So they got the lead out back in the early 70s, I guess. When you used to have two different size nozzles, so you couldn't put leaded gas in an unleaded machined automobile. And now
Right.
they're all lead free.
Right. Yeah, lead.
And
Lead
get the
or
lead
unleaded?
out. Get the lead out of your paint. So we're
Oh.
trying to get rid of lead. And to think, the Romans actually used lead piping as their plumbing.
Oh.
Because it's soft, it's malleable, you can configure it in any manner you'd like, and almost any size, and plentiful. So it was
Wow.
easy to work with.
Just that lead taste is a little different.
Lead is sweet to the taste, so they probably had what they thought was a great deal going there. Their water is slightly sweetened because it was lead lined.
We don't advocate that.
Well,
but,
we definitely don't advocate that, and so continuing that process of getting the lead out, here we are in dentistry, and as you probably know, what is contained in those aprons that we put on before you take an X-ray is a very, very thin layer of lead, encapsulated in that vinyl and stitched
which weighs
apron,
a ton.
a lead apron, and that's why it's so heavy. It has to be a certain thickness. So a certain thickness to prevent radiation penetrating that. Lead and concrete are about the only things that really absolutely prevent radiation from penetrating through them. It effectively blocks it. That's why, back in the old days too, there was lead and silver fillings. Well, you could see the fillings.
That's true.
Pretty readily on the X-ray. So here we are. We're into a new era. Digital X-rays, digital radiation.
So what again? Since we talked about kind of the old days there, remember the days when we'd take a little film about this big, put it in your mouth. You have to go in the dark room and you hope no one would open the door and
to expose the light on the film. And those little films, every one of those little films had a lead lining in it. So you had lead foil. So you would collect that, and at some point you could effectively dispose of it. But predominantly we pretty much threw it in the trash. Which there wasn't any way to dispose of it. The way that they would typically think about disposing it is burning it. Well, you're putting lead fumes, literally lead fumes, into the air for all of us to breathe. Not practical, but sometimes that was done. So fortunately, we got rid of the lead foil in the X-ray, but we even, of course, at that time still used the lead aprons. And now we still use the lead aprons, but with the advent of digital X-rays and digital sensors instead of an actual piece of film, which was also a messy process to develop because you had to have silver nitrate and liquids and fixers and other, presenting another whole range of plumbing type problems and sewage sanitation problems. We don't have those chemicals anymore, but we do have to contend with the radiation. So, and radiation generating devices. Fortunately, they're so much more sensitive, which means we can use far less radiation than we used to get an X-ray. Plus, and here's the real bonus, the advent of computer enhancement of the X-ray.
Right.
Now, instead of looking at that 1.5 by 1 inch piece of film and maybe getting a magnifying glass to hold it up and see if you can make something look better or bigger, you can enhance it on the screen, make it as big as you want, literally as big as you want, so that little thing can be as big as this whole screen, or any of the screens here, and then you can see some more detail, some things that you might not have seen before. And like I said, enhancement of that image itself, making the whiter things white and the darker things darker, gives us better contrast, and so we can actually see what we're looking at. And now I couldn't even think of how it would be to go back. I can't even think about looking at that one little X-ray.
I did have something where I saw an X-ray, and I hadn't really seen one in probably it's been a while, and I'm looking at it, I'm like, oh.
Yes.
Trying to, so.
Focus and visual enhancement is what it's all about nowadays. So what does this have to do with lead? Well, the whole point is you're using far less radiation from that X-ray machine it is heavy, but we aim it through your jaw to get that image on the sensor. Well, we have to use far less radiation to generate that image onto the sensor than we used to with a traditional film. So the point is, now we've come to this point that radiation nothing escapes. That cone that we use is called a collimator. It makes the radiation funnel into that small channel, not as big as that round thing that you see that's about 3 or 4 inches
Right.
wide. No, it's collimated into an even smaller image, that the radiation is actually exiting that cone into the sensor. So we use far less X-ray. And that collimator is lead lined,
Right.
as it turns out, because it'll funnel the X-rays. The scatter won't occur. So the X-ray is not going anywhere except exactly where we're aiming it. And if we're aiming it there and using far less than we used to, there's virtually no risk of radiation escaping. And that's been shown because there are badges that people wear to monitor their X-ray exposure, and that would be for employees, not for patients, because a patient typically is only in every few months for X-rays. But so as an employee, the concern is scatter of radiation, which would apply also to the patient, him or herself. And we've worn these periodically at different times, because every time there's no radiation detected on that monitor. So now what are we doing here with these X-ray lead aprons? They're not really preventing much of anything, because there is none. There's nothing to prevent anymore because there's no scattered radiation. So that comes to the whole thing. Lead aprons, that heavy thing that we slap on you, and when we take an X-ray, and you wear it for that moment, and then we take it off and hang it up on the wall. And then there's also the problem of disposing of the lead apron. I mean, that actually is a regulated issue, and that's a whole different ball of wax. But now, with the advent of not using the lead aprons, pretty soon even that will go the way of the dinosaurs. So that's great. I mean, it's one less step to have to take, one less thing to worry about from cross-contamination aspect, because we've touched something, we're touching that apron, now we have to disinfect that apron when we put it back up on the wall too. So we're cross-contaminating one more thing. But as it turns out, and we had just literally started discussing this, what are we going to do? I mean, we're so used to doing it. What do you think?
I say, we'll probably still utilize it there, but again, just keep in mind, as Dr. Huetter mentioned, it's really not necessary. So,
well, and the only exception would be if a patient is pregnant, knows she's pregnant, and lets us know that she's pregnant. Yeah, I would do it. But, there's so little to lose for that instance, because we also rarely do take an X-ray on a pregnant patient unless there's a specific problem, and we absolutely need to know what that problem is. So we need an X-ray. There's no other way to detect what it is or find out what we're doing. So we will take an X-ray. And occasionally there can be a patient who doesn't know she's pregnant early on, but we may still take X-rays. So using the lead apron, I guess, is still on the agenda, but I could see where it's fading away.
Right, correct. Right, I agree 100%. So at the end of the day, we're looking for your safety and the safety of our team members as well. And again, that study literally came out, and we've been discussing for years about utilizing the lead apron or not. So when you come here, we'll probably still use, especially in the winter, because it keeps people nice and warm.
But speaking of which, though, didn't they just come out with this new regulation, or not actually a recommendation?
Right. Science.
Mm-hmm. We don't have to use it.
Correct. Right. So, we probably still will use it, but as Dr. Huetter mentioned, if you don't use it, then that's not an issue either.
It's a non-issue. Not to mention, one last thing about lead. We put lead in the walls. When we know that there's a radiation generating device, especially the panoramic, the one that goes around your head, or cone, also known as a cone beam now, which is a three-dimensional enhanced form of that panoramic. There's lead actually in the wall when they put the wall up, so that radiation is not going to scatter from that, because it actually is pointing in multiple directions and generating that radiation in a circle. It's not going through the wall. So as long as you're not walking by in the hallway, which is why we don't let you do that while we're taking it, then there's no chance of scattered radiation or exposure from that machine either.
It's just, see, the thing with technology and science, the more we learn, we'll do things differently than we did, 20, 30, 40 years ago, even 5 years ago.
Yeah, even 5 years ago, and certainly 10 to 12 to 15 years ago, when digital radiation and X-rays really wasn't around, and now I think you'd be hard pressed to make a case for not using digital X-rays. If you're still taking these little bitty films, you're behind the times. You're missing things. You just are. You're missing.
So again, Dr. Huetter, our main goal is patient health. So obviously, as things change, we adapt. That's what you do.
Right.
So information comes, then we adapt as long as it's best for our patients. That's what we're going to do. So don't be surprised you come in and you don't have an apron on, but a lot of times we'll probably just put it on because habits.
Habit. Right.
And it's not going to hurt you to have that lead apron on.
No, because that is safely encapsulated in that vinyl and tightly stitched apron blanket.
Right. So get the lead out. I like
the lead out.
I like that.
I couldn't help it. I couldn't resist. We're getting the lead out of everything.
Well, we appreciate all of you watching us. And again, if you have any suggestions, please feel free. Let us know via email, via social media, or even you can old-fashioned calling us.
You can call.
All right.
330-452-2255.
Oh, see, it's so easy to remember. Right? You did. That's awesome. So
everyone just presses a button anyway, and you get what you want.
Right. I don't actually remember phone numbers anymore.
Yeah.
I do remember my phone number from growing up there.
Yeah, when I was growing up, I can't. Anyway, I won't tell you what that is because I use it as a password.
Okay. Oh.
So anyway,
all right.
thanks for watching.
Absolutely. For Brian Amison,
Richard Huetter.
have a great day and be safe.
Be safe.